Welcome back, everyone, to the National Academy of Medicine's 2025 Global Innovator Summit. Next up is our first Global Collaborator Showcase. Throughout the summit, we'll honor many of the NAM global partners who have sponsored Catalyst Award competitions in their own country or region. While there are some core similarities between all of the Catalyst competitions, each partner has also tailored their program to meet local priorities and institutional requirements. These sessions are intended to honor the NAM's global partners, highlight their contributions to the Healthy Longevity Global Competition, celebrate local impact, showcase innovative approaches, and share awardee success stories with our broader community. So without further ado, I will hand it over to my colleague from the Chinese Academy of Medical Sciences. Jing, the floor is yours.
Thank you, Michelle. Dear President Victor Zhao, dear Michelle, dear colleagues and awardees from Global Collaborators, good morning and good evening. I'm Jing Xie from Chinese Academy of Medical Sciences. It's my great pleasure to have this opportunity to be connected with all of you in this Innovator Summit convened by the NAM. Let me first give you a quick overview of Chinese Academy of Medical Sciences, short for CAMS. CAMS, together with Peking Union Medical College, PUMC, is a comprehensive medical research, service, and education system with 21 research institutes, 6 hospitals, and 10 schools. Among our hospitals, I want to mention here is the PUMC hospital is the #1 comprehensive hospital in China hospital rankings all the time. And Fuwai Hospital, one of the world's largest cardiovascular disease hospitals, and our cancer hospital, the largest cancer hospital in Asia. And also Plastic Surgery Hospital, the world's largest plastic surgery hospital, Blood Disease Hospital, the largest blood disease hospital in China, and the Skin Disease Hospital, the world's largest skin disease hospitals. So with such a comprehensive research and healthcare and education systems, we, CAMS, has joined the Healthy Longevity Global Competition in 2019 and has been in this fantastic journey with NAM and other global collaborators for 6 years. As the leading medical institution in China, we have organized 6 rounds of healthy longevity competitions with nationwide and diversified participation both within and outside CAMS system. Now let's walk you through some key figures in CAMS Catalyst Award. Over the 6 years, we have received 1,164 applications through a 3-step review process, that is administrative review, followed by the scientific panel review, and finally an in-person pitch competition. 180 awardees have been funded with a total of $9 million. And here I want to show a unique feature in CAMS Catalyst Award. We have spurred a robust momentum in innovation from hospitals. We've noticed that there are unmet needs from patients alongside with unmet funding needs from clinicians. By focusing on problems raised by clinicians and providing resources to address those problems in novel and creative ways, we can not only contribute to patient benefit, but can also introduce new ways of thinking or whole new paradigms to research. To this end, our funding strategy is both forward translation, that is from bench to bedside, and reverse translation, which is from bedside to bench, are placed at the center, promoting risky but potentially fruitful translational research. So you can see from the bar chart here, half of the applications were from hospitals. And so with that, in today's showcase session, 2 awardees from the Capital Medical University Xuanwu Hospital and the Peking Union Medical College Hospital will share their project with us. So without further ado, let me save the most of the time to our awardees to share with you their project. Okay, now I will give the floor to our first awardee, the awardee of 2023, Dr. Ming Li. Dr. Ming Li, the floor is yours.
Okay, thank you, Dr. Xu. So I'm gonna share my screen now. Sorry, I think I cannot share if you still. Oh, yep.
Is that okay now?
Yep. All right. So, yep. So, hi everyone. My name is Ming Li from Shem Hospital, Capital Medical University, Beijing, China. I'm very pleased to present our research project to you. The title of my presentation is Development of Autologous Blood Hypersonic Neuroprotection System for Brain Injury based on Neurointerventional Technology. The application background of our instrument is the treatment of stroke patients. As is well known, stroke is the leading cause of death and disability in China. Compared with the United States, Chinese adults face a lifelong risk of stroke as high as 39%, and the mortality and disability rate is 4 to 5 times higher. The total number of patients in China exceeds 30 million and is still increasing at an annual rate of 8.7%. Intravenous thrombolysis and mechanical thrombectomy as the first-line treatments with a vascular recanalization rate as high as 90%, yet the favorable outcome rate is only 50%. The reason is that after recanalization, reperfusion injury occurs in the ischemic brain region, leading to poor prognosis. Studies have indicated that hyperthermia can effectively elevate reperfusion injury. However, currently in clinical practice, whole body hyperthermia has significant side effects, and head cooling caps have poor efficiency, so can ischemic region be rapidly cooled locally? Based on the above background, our team, led by academic Ji Xuming, proposed intra-target hyperthermia therapy for brain protection. Professor Jun Chen, editor-in-chief of JCVFM, states that this is currently the only international research team that has conducted full-chain hyperthermia study ranging from cells, small animals, and non-human primates to clinical patients. The American Stroke Association has listed as a priority research area for the next decade. Currently, autologous blood hyperthermia technology used clinical mostly rely on ECMO equipment, which is primarily used for cardiac arrest patients with a flow range of 0 to 8 liters per minute, unstable and low flow rate, and catheter lack insertion during cooling. Our device is specially designed for ischemic stroke patients with a flow range of 10 to 50 millimeters per minute. Stable flow rate is in the low flow range, enabling local brain tissues made hyperthermal. The system primarily consists of a neural intervention system and an extracorporeal circulation system. Blood is drawn from one femoral artery of the patient called extracorporeally and then infused back via the contralateral lateral femoral artery, perfusing the brain through the carotid artery. The specific components of the system are as follows. For the interventional system, we first developed an air-installed hyperthermic catheters, achieving a 30% increase in energy exchange efficiency and a significant decrease in catheter outlet temperature. Furthermore, we prepare an insert layer on the catheter surface composed of silk fibrin and nano-hollow silk cefers, enhancing catheter insertion performance by 20%. For the heat exchange system, we developed a low-flow, high-efficiency blood heat exchanger, increasing heat exchange efficiency by 20% and reduce the risk of coagulation by 30%. At the same time, we also developed a heat exchanger based on semiconductor cooling technology to further improve cooling safety. For the power circulation system, we developed a low-flow magnetic blood pump head, preparing a long-term thrombotic coating on its surface, significantly extending the safety of the pump head. Through computer simulation, we optimize the pump head structure, reducing the homocysteine rate to 0.1%. Regarding system integration and testing, we complete 3 prototypes: the concept verification prototype, experimental prototypes, and acceptance prototypes. Based on safety verification in healthy large mammals with pigs, we successfully achieved target brain cooling, which the delta T is equal to 2 degrees. While the core temperature remain unchanged, that delta T is less than 0.5 degrees. Based on safety and efficiency study in a rhesus monkey IS mode, the neuroprotective effect of the prototype was confirmed, showing the infect volume reduced by 39.7% compared to the model control group. Professor Max Fisher, president of the World Stroke Organization and former editor-in-chief of Stroke, notes that our research provides new medical instruments for large animal stroke trials and clinical studies. Professor Jean-Claude Braun, fellow of the UK Academy of Medical Science, states that intravascular target cerebral hypersomnia is a highly attractive therapeutic approach addressing the challenge that hypersomnia is affecting stroke but difficult to translate clinically. President of the International Hypersoma Society, Professor Patrick Lind, states that this team demonstrates the safety and efficiency of the intravascular target cerebral hypersoma in patients, representing a landmark achievement in the field of hypersoma research for stroke therapy. Regarding progress in technology and translation, we successfully signed a collaboration agreement with the Higher Group for the translation of a hypersoma instrument, accelerated clinical application and promotion. And we also successfully completed 2 commercial prototypes. The key technical specifications meet clinical requirements. We also established relevant diagnosis and treatment procedures, achieving efficiency in patient pathology management, including case creation, historical data query, and historical data export function. The user interface is shown in the figure. Furthermore, we received awards including the Innovative Research Award, the second prize of the Beijing Medical Science and Technology Award, and the Translational Medicine Innovation Award. We have trained several excellent PhD graduates in the field of biomedical engineering. Students won the second prize in the Biomedical Engineering Innovation Design Competition and the Outstanding Achievement Award from the Chinese Society for Measurement and Information. In the future, the technology can be further extended to local hypersomic protection for vital organs such as the heart, lung, and the livers. Thank you for your attention.
Thank you, Dr. Ming Li. Here I want to share an anecdote with you. That is 3 years ago when we first received the application of this team, we were really impressed. And after that, each year we received a lot of applications from the same team, and they are all very innovative and all won the awards. Till now, I think there are 5 applications that has won the Catalyst Award. And we are so impressed by the team leader, Dr. Xunming Ji. And this October, Dr. Xunming Ji has become the president of Chinese Academy of Medical Sciences. So I think this Healthy Longevity Global Competition has really connected us with Xuanwu Hospital and also connected our leadership team. And next, we will have Dr. Wei Li from Chinese Academy of Medical Sciences, Peking Union Medical College Hospital to share her story with us. Please, the floor is yours.
Dear President, organizer from NAM, and awardee from Worldwide, good day to everyone. My name is Angelina Wei from Peking Union Medical College Hospital. Today, I'm honored to share my presentation and to present our project, Bridging the Gap, an integrated care referral system for older adults. Our goal is to address one of the most critical yet overlooked issues in the healthcare setting, the transition from hospital to home, a period of high risk for older adults globally. By 2030, 1 in 6 people worldwide will be aged 60 or above. This demographic shift places enormous pressure on healthcare systems. Post-discharge, older adults face high risks. In some systems, 15 to 20% are readmitted within 30 days, often due to poor coordination and unmet social needs, such as home care, transportation, and emotional support are rarely addressed, leading to avoidable distress and costs. This is not just a clinical issue, it's a system failure. Care remains siloed. Currently, hospitals focus on acute treatment, while social services work separately on community support. Between these silos lies a black hole of care coordination. Patients are left vulnerable, caregivers feel overwhelmed, and the system bears unnecessary costs. Having worked in healthcare systems in Singapore and UK for about 15 years, I've seen how this leads to functional decline, caregiver burnout, and avoidable costs. In China, with rapid population aging, this problem is especially urgent and globally relevant. Our primary aim is to develop and pilot a technology-enabled integrated referral system that connects hospital-based geriatric care with community-based services. We hypothesize that a model to co-designed by a multidisciplinary team, including geriatricians, nurses, therapists, and medical social workers, and enabled an interoperable digital platform will significantly improve patients' outcome, caregivers' well-being, and system efficiency. The model stands on 3 pillars. Firstly, a data integration engine which securely connects to hospital systems and extracts clinical information. Secondly, algorithm-driven care planning, which generates evidence-based social care prescriptions. Finally, human-in-the-loop coordination, where medical social workers personalize and validate the care plans, provide psychosocial assessments, and serve as a single contact point for the patients and families. This ensures technology augments, not replaces human expertise. Besides, we surveyed 42 institutions across Beijing, capital of China. Key findings were clear. There is high demand for standardized referral processes. We also found manual referrals take over 50 minutes per cases. Our system is projected to cut that time by 60%, freeing up clinicians for what matters most. These results highlight both the needs and the feasibility of our intervention. In June 2025, we convened a symposium with over 60 experts from geriatrics, psychiatry, social work, and elder care, including some colleagues from Canada and Australia. Together, we validated the need for cross-sector collaboration and integrated psychosocial medical frameworks. Insights gained directly shaped the design of our referral system, ensuring it is both evidence-based and practically grounded. Our pilot project, the study, will recruit over 200 patients discharged from Peking Union Medical College Hospital, each with at least one unmet social need. We will assess patients' reported outcomes, such as quality of life, process metrics like care plan adherence, and system-level outcomes, including reduced readmissions and the caregiver burden. Both quantitative and qualitative methods will ensure rigorous evaluation. If successful, this project will demonstrate how integrated care improves recovery and quality of life and advance the biopsychosocial model of care. It will provide global evidence for integrated care. It can influence policy by supporting value-based payment models. And importantly, our technology is designed to transfer adaptable to other healthcare systems facing similar challenge worldwide. Systemic integration is key to sustainable aging. Colleagues, to conclude, we have a unique opportunity to bridge the gap between the hospital and the home through a technology-enabled human-centered model. This is not just about reducing re-emissions. It is about dignity, coordination, and the person-centered care for our aging population. We welcome your partnership to help scale this vision and to learn together how to care better worldwide. Thank you for your attention.
Okay, I think that's all we want to share today from CAMS. And I think these two projects have perfectly showcased how CAMS has done through this healthy longevity journey to make this translation, no matter into the industry or into the social community. And in the future, we hope to we can jointly make more efforts into this global community.
Thank you so much, Jing and Mingli and Niwei, and the entire team from CAMS for your continued dedication to the initiative. We really appreciate it. Now I'll transition us to a short break, after which we will proceed with our next showcase session featuring our colleagues from
AC. On behalf of UK Research and Innovation, speaking about their very unique Catalyst program. Stay tuned. Thank you.